I'm Dr. Keith Lonergan, originally from Connecticut. I've been at Steadman Hawkins here for 3 years. Currently I'm stationed at the Greer office, and I'm the managing partner out there. I think for me, I've always wanted to do orthopedic surgery. There really was no other part of medicine that I truly wanted to focus entirely towards. I was always involved in sports. I've always loved to work with my hands. I've always enjoyed anatomy, and it was just a natural progression. I've been truly blessed with my training. There is no way that I would ever trade the course of my education for anything. I was involved very early with extensive exposure to many things in orthopedics. I had excellent mentors. My training began in the military, where we had the best teachers, educators, the opportunities for expanding our horizons and making sure that we had the skill sets and the patient follow-up that's needed. So for 5 years I was in the Army as a training as a resident. During that time I actually had a chance to become a flight surgeon. I went out to Korea where I was a flight surgeon, general medical officer. I had a chance to do a lot of medicine, but I also had a chance to fly helicopters and take care of some different types of injuries. I did a 2-year fellowship. The first year was in San Antonio, Texas, where I was heavily involved in sports and trauma research. I also did a tremendous amount of clinical medicine, where I did many surgeries. After the first year of my fellowship, I did another year of fellowship at West Point at the U.S. Military Academy in New York. During that tenure, I was one of the team physicians for West Point, and I conducted many training rooms, as well as taking care of essentially every student as an athlete. After the 2 years of fellowship, I was assigned as the Southeast Regional Consultant for Sports Medicine for the Army, where I was stationed at Eisenhower Army Medical Center in Augusta, Georgia. At that time, I was the Chief of Sports Medicine and Shoulder Service for 5 years, where I was, once again, I was teaching the younger residents. At the very end of my Army tenure, which was 13 years, I actually was privileged to go to Iraq, to Baghdad, where I was the Assistant Chief of Surgery and the Chief of Orthopedics for the major trauma center in Iraq. So during that time, I was exposed to many things that you do not routinely see in the civilian world. After being in Iraq and completing my Army obligation, I joined Steadman Hawkins. The types of surgeries that I primarily perform are shoulder and knee reconstructive surgeries. I perform a lot of arthroscopy. Being sports medicine trained, we've been able to develop more minimally invasive techniques. So a lot of the surgeries that were performed through larger incisions or open techniques, now we can do through small incisions. Of all the surgeries I do, I primarily focus certainly on the shoulder and knee, but I honestly do a lot of elbows and ankles as well. But one of my other primary focuses is on fracture management and trauma. Patients should expect a lot from their surgeons. A surgeon is someone who you make a small marriage with, if there's such a thing. You need to develop a relationship with that person. The patient-doctor relationship is always important, but when you are responsible for taking somebody to surgery and potentially affecting their life the way we do every day, you expect the best. You expect honesty. You expect skillful art of medicine. And there is no option. It has to be the best that you can provide. I'm committed to what I do. I love what I do. I've been doing it for a long time. And since I can focus on sports medicine, arthroscopy, shoulder and knee reconstruction, I do it every day. I continue to explore the latest techniques through the literature, through training. And with that, I've gained a lot of experience. I have a lot of passions in life. First and foremost is my family. They are the most important thing to me. When I come out of the office and it's been a busy day and it's time to go home, that's when I have another hat I put on. Dad, husband, plumber, electrician, whatever it may be. So they may not know that about me. They may see me as just the surgeon, but I love to spend time with my family. So I have 3 children. I have 2 boys and a little girl. My wife and I got married in Hawaii, where we met during my residency. So I have a lot of passions. I love fitness. I love golf. I've started to play a lot of tennis. Love to go to the gym. Just love being outside.